Welcome to the Taylor Method for Pain-Free Living, a podcast that features enlightening conversations with experts in the medical field that helps to improve the health and well-being of those suffering from chronic pain due to injury. Learn from leading authorities the questions you should be asking to experience pain-free living. Hosted by father and son, Dr. Derek Taylor and Dr. Hudson Taylor, and joined by industry professionals in the health field, including doctors of integrative medicine and personal injury attorneys. Enjoy well-rounded and informative conversations to help you get out of pain while achieving optimal wellness. Dr. Derek Taylor and Dr. Hudson Taylor are the doctors of Taylor Chiropractic and Laser Center in Florida and California. Both father and son duo have earned respect and a solid reputation for successfully helping people transform their lives by assisting them to discover the hidden causes of their painful health challenges, leading them to experience the resolution of their problems using the Taylor Method. Tune in each week to learn about the Taylor Method, Dr. Taylor's proprietary technology that looks at the whole person and identifies the root cause of pain while facilitating natural healing and helps to restore the body to optimal wellness without using drug injections or surgery.
Welcome to the show. Our guest today is Jamie Gonzalez, business owner of the Salt Suite PGA. Jamie opened the first franchise of the Salt Suite right here in Palm Beach Gardens, and salt therapy is a natural, effective treatment for relieving symptoms of most breathing ailments, skin conditions, sleep disorders, and stress. Jamie, welcome to the show.
Thank you. Thanks for having me.
Yeah. So when did you open up this location here?
So in 2015, September 2015. So we're about to have our 7th year anniversary. Very proud of that we made it
Congratulations.
this far.
Yeah. So you've been around for a little while. It's not brand new here.
Oh, no.
So a lot of our listeners have never heard of salt therapy. Why don't you tell us a little bit about what is salt therapy?
So salt therapy is something that came from in the 1800s. The story goes that Polish salt miners weren't showing ailments like their counterparts, like their peers. They would, they were in the salt mines all day. They didn't suffer from the normal colds, bronchitis, and allergies. And Polish health officials thought, what's going on here? So they started taking people with breathing ailments and having them hang out in the salt cave and where they were mining, and actually relieve their symptoms for days when they would come out of that. So this is, 1800s. So you haven't seen the salt caves proliferate here until the last 10 years they started opening. There's still so few. We're really lucky here that we have our franchise. We have 4 locations in the county. So salt therapy, think of those salt particles, like I always say, who hasn't heard of flushing with salt rinse for your sinuses?
Absolutely.
Who hasn't said, we used to go to the beach as a kid. My grandmother would pack us in the car when we were getting something and, have us breathe the salt and swim in the ocean, for cuts even, and, how it helps heal everything. So, salt is a mineral that's required by our body. But the way that the salt therapy clinics work is we have halo generators. Halo's the Greek word for salt. It grinds the salt into fine microparticles that are inhaled when you sit and either relax in we have an adult treatment room. And then this is an older picture, but this is the adult kids room. So there's actually these comfy chairs in our kids room now, so the adults can relax while their kids play. And by breathing in those salt crystals, a couple things. Salt's anti-inflammatory, so it kind of releases and opens everything up so you can just get more air in, relieving inflammation throughout the whole body by breathing it in, salt getting into your bloodstream. And of course, that's the anti-inflammatory benefit for the whole body, not just the lungs. And then it acts as a bronchial brush. We could say it's like a toothbrush for your insides. So those little particles get in there and scrub against the cilia, and release salt draws water. So it actually attaches to the water and therefore mucus, and gets it out of your body, breaks it down. So people have an effect of drainage from their sinuses, the scrubbing and relieving the mucus from their lungs, ear canals are drained and liquid absorbed from the ears. So we see a lot of ear infections as well, especially with the kids, you know. So bronchial brush effect, the anti-inflammatory effect, and then something we don't talk about a ton, which is the negative ions. You know, ions are all around us, positive and negative, but all the EMFs and a lot of stuff we do to our bodies kill the positive ions or knock down the negative ions, which is opposite, right? The negative ions, they call the happy ions. So those negative ions being created by the grinding of the salt really relax the body.
Jamie,
It's called a salt fog when we come out, very relaxed. Yeah.
Jamie, this is such a fascinating, you know, physiological process there, and it just made me kind of wonder why salt therapy for you. What resonated with that?
So first of all, I come from a spa background. My mother's was in spa and taught me about Ayurvedic medicine most of my life. So I always came to everything with sort of a natural, you know, mindset first before, you know, I'd go for medications. Although as a child, I suffered from a lot of ear infections and did have a lot of antibiotics. So because, you know, back then, like my mom didn't know how to get rid of them. So she'd try these homeopathic things and end up at the doctor and drugs, you know, even back in the 70s. So for me, I had a first symptom in 2005. Oh, sorry, I just did something. I swiped and messed up something, but looks like we're still on. I know you can, what do you call it? Get this, sorry. Oh, there we go. I got my view of you back. In 2005, I had short-term memory loss. I was working for a big company, worked for 25 years in corporate America. And they said it might be MS. It might've been a stroke. They weren't sure. Went through a lot of testing. And then 5 years later, I started tripping over my foot. So I, you know, ran back to the neurologist and I was tested and I was diagnosed with MS. So I went on for a year of course of daily injectable drug. And I just kept, you know, intuitively, it just didn't feel right. It's, I thought there's got to be natural, you know, ways to do this. I had 2 things in 5 years, which people with MS often are having multiple exacerbations. And I wasn't. So I stopped the drug and I did a lot of studying the Swank diet. Now we have Terry Walls, you know, who promotes the Walls diet. She's a doctor who reversed her MS with foods and, you know, all the healthy stuff that we do. So in 2000, I opened 2015. So in 2010, I was diagnosed and, you know, just started this whole trajectory of what can I do for myself? A friend introduced me to the Salt Suite in Delray. And whenever I left there, I felt very aware. I didn't have any sinus issues or breathing issues, but I just felt this very calm, you know, open, aware feeling, which it kind of decongests you. So you'd be amazed what congestion you have, even if you don't know you have it. And so I was really interested in opening something that I would talk to moms in the Delray Salt Suite, had avoided surgery, you know, had to have tubes in their kids' ears and adenoids removed, adults who had tried all kinds of medications and they were, you know, found salt therapy and they were getting back to their active lifestyles after, you know, a lot of drugs didn't work. So I was just so excited about it. I said, you know, if you guys when you're ready to franchise, let me know. So when they were, that's how it became the first location. I opened up on PGA, kept my corporate job for a few years, but got rid of that in 2018 to do this full time and hopefully bring on more locations. But of course, COVID made, you know, a bit of a challenge for a lot of us, but I did never close. So it's been a really, really rewarding business to open because, you know, you see people get so much great healing. So that's how I came to it from my own, you know, my own illness and really fear, you know, the fear of progressing with MS. I went right on medication, but I want other people to follow their intuition and, you know, listen to their body. And I say the low hanging fruit of, you know, healthcare is everything we can do for ourselves, you know, rest, you know, keeping your mind healthy and clear, whether it's meditation or whatever you got to do. And of course, healthy foods and lots of hydration. And there's so many things we can do before we go right to harmful pharmaceuticals, potentially harmful.
So MS is an autoimmune condition often
Mhm.
caused by people eating gluten and dairy and just a poor eating the standard American diet, sad. And their body starts to attack itself. Now, if this has helped with yourself, have you seen other autoimmune conditions? People with other autoimmune conditions benefited from the salt therapy, such as people with Hashimoto's or diabetes,
RA.
Parkinson's, or Alzheimer's, or have you seen any other conditions, symptoms relieved, or do you have patients that come in like that?
Lots. So I would say the first one that we realized it was helping a lot was RA, rheumatoid arthritis. And it's so common, but think about it. It's an inflammatory problem, right? So the inflammation, and I haven't touched on Beamer. So I also have a PEMF, as I noticed on your site, you also use a PEMF technology. So as people know, I actually brought this so you could see, because when I say Beamer, people say, oh, you got a new car. I say, no, I got something better. So this is the logo, but it's bioelectromagnetic energy regulation. And I'm sure, are familiar with it, but it's an FDA cleared class 2 medical device. And that I added to the business a couple years after I opened, hesitantly, because it's a $6,000 medical device. I'm like, well, my halo generators were about that much each. So, let me make this investment, because I would bring it in. And especially I had a woman with RA, and she said that she always felt like it was helping her. And I felt like it was helping me. So I put that in the business, and definitely helps relieve inflammation. As you know, oxygenation is everything. So when we can open up people's airways, get rid of the congestion and, stuff that's in the way, and then get them on PEMF, it's, infusing their tissues, everywhere with enhanced oxygen flow and, of course, detoxification. So that is kind of the holy grail. And that's why I think the PEMF has not been, hasn't been, you'd think everybody's using it by now, because there's not a lot of ways to increase oxygenation. So you probably know all the stories about PEMF, but I encourage people to read up about it. I've got so many great articles and literature. I've got another client with Parkinson's. He came to us pre-diagnosis, just, doing the salt therapy, and he and his wife both have, some chronic pain and this and that. And they started using Beamer. He was diagnosed with Parkinson's, and he knows it's helping because he's not progressing that fast. His doctor said that he's never seen someone on the medications who it's working so well for him. The medications are really helping him. So again, combination of, Western and pharmaceutical medication, along with, our integrative approach, I think is really working for him. So Hashimoto's and the others, I know, anything, oxygenation. I can't say, I don't know if I have any, I know I have people who come with it, because of course, a zillion women have, probably half the women I know have something with their thyroid, probably more than that, including me. But they told me I had Hashimoto's, but just because of one thing on my blood work was elevated, one number, but I have no symptoms. So, what's that tell you? I mean, I go by my symptoms, how I feel, I get regular blood work, but I know the relaxation effect, which most people can use, because let's face it, people are ultra stressed. Whether it's, well, we won't go into the reasons why, physical stress, mental stress, oxidative stress, which we know PEMF really helps with, oxygenation and relaxation, and helping people sleep. And that's another one that's chronic, along with stress, is people are not sleeping well.
I would think, there's people that have, that are on their CPAP machines. They need these devices. They have snoring issues. They have a lot of congestion and inflammation. I would think the salt therapy would be really great for bringing that down. Have you seen?
Oh yeah.
Tell us.
Absolutely. Yeah, I have clients who report that they don't really need their CPAP if they're coming regularly. Not that we ever recommend that, of course, everything's about working with your, health professionals. But absolutely, snoring is reduced.
Right.
I educate people about mouth breathing and how they have to get back to nasal breathing, which creates NO2, among other things. It's really a requirement that we breathe through our nose,
Yeah.
and and we're breathing fully. But yeah, the CPAP, sleeping, and both Beamer and Salt are the PEMF and the Salt are really great for sleep. We have a lot of people bring in children who I've had multiple phone calls, or first thing in the morning, from a mom who will say, "Does this help with sleep?" Like, they didn't even ask. They came for their kids' congestion, whether they were teething, ear infections, whatever's going around school. And by the way, we don't let anyone in with, we screen people that they don't have active infection, contagious, or a fever. So it's not a place to come when you're sick. It's prevention, and then post whatever, the bronchitis and even the what do you call it, COVID? How can I forget that? People are coming in post with a lot of leftover cough, congestion, and it really helps clear that.
Tell us about the antimicrobial properties of salt therapy.
Well, right, salt is antibacterial as well as antimicrobial. So we feel very safe in the rooms, that people can't, if you exhale, and there's a lot of good science, I'm watching a lot of that during COVID, scientists talking about salt rooms are a great place to be, because when we exhale, and we know now that, right, that's how you get COVID. Someone exhales droplets, you inhale them. It's not from touching your groceries. In our rooms, when you exhale, there's salt everywhere. It's just proliferating the room. You can't get away from it. And therefore, salt is going to attach to that microorganism and basically suck the water right out of it. And anything without liquid, any bacteria without liquid is not going to live. And even if it gets into your body, it's going to help it limit reproduction.
It seems like if somebody had COVID, that'd be the safest place for them to be in. I mean,
Yeah, that's why I said we were, shutting down during COVID. I guess we had to close. I guess
that's an oxymoron. You shutting down during COVID. It seems like this is where everybody should be in. That's the safe. Yeah. You're probably the safest room in all of Palm Beach Gardens.
Yeah, it really is a healthy. And listen, the beach. During COVID, people were staying home. I said, "Well, you're going to the beach, aren't you?" And then the beach is closed for a while.
Yeah.
The ultimate, idiocy of our government that, closed down the safest, healthiest place people could be.
So I try to get to the beach. Dr. Hudson as well. He lives in the Southern California, the beautiful beaches there. And we, of course, live in the beautiful beaches of South Florida. I try to get there at least 3 times a week. The vitamin D and just the salt water in the air. I come back just so relaxed and refreshing. How is this different than going to the beach? I would imagine this would be like going to the beach, but on steroids, right?
Oh, yeah. They say, so our sessions are 45 minutes long, except we do have a salt booth, which I hadn't mentioned, but it's not on here, but picture a cozy telephone booth with this clear, so you're not, if you're claustrophobic, most people are fine with sitting in it. And you get the same delivery of salt in 10 minutes because you're in such an enclosed, area. So you're getting a lot of salt. But
That's
they say
a busy person that's on the go doesn't have time to sit there for 45 minutes.
And I actually have a mom who just brought her 15-month-old for 3 months. The first month she was checking out with her other daughter. Then her daughter had, her little one had all the liquid in her ears. And it took 2 months of coming pretty religiously, but it totally cleared the child's ears of liquid, because it, salt absorbs. We know that. That's like a simple. So once you get it, you got to get enough in there. But yeah, and she said the doctor was shocked that she was able to clear the liquid without, I said, well, I hope he was shocked and will recommend salt therapy, which we do have local doctors who recommend salt therapy, and a cardiologist who sends people regularly for Beamer, for PEMF, which, by the way, there's, PEMF has a protocol for COVID and myocarditis that's been really helpful for some clients. So that's just, I don't know. I just feel like it's, God sent, like all these therapies that we've been able to And it's, like I said, it's the low hanging fruit. It's nature. We're just taking nature and, getting it into people in a way that they couldn't, like you said, go to the beach. I go to the beach too. And many people, the sun, 45 minutes in our salt rooms, like 3 days on a sailboat. That's what they say.
Wow.
So of course, yes, if you live on the ocean, you can open your doors and you're getting that all the time. Maybe you don't need salt therapy, but for most people, the sun, getting a sunburn, having to sit there for hours and hours to get the same benefit. So of course, and this is a cool, dry climate. You leave your clothes on. So it's very accessible for all ages. The kids play and, with toys in a playroom. So yes, you're getting a whole lot of salt. I hope you guys will come check it out. Maybe your son will come visit. Come see me.
I would love to. Jamie, are there any times when you wouldn't do salt therapy with the patient if a patient wanted to get salt therapy, but like a contraindication?
One of them is kidney disease. So we know that people are told to avoid salt with kidney disorders. Typically, it's like a later stage kidney. What do you call it? There's a word for that. But so, and we always say, we recommend, talking to your doctor if you have anything really serious. Of course, PEMF you're not supposed to do with. You have to be really hydrated. I have a client right now who's very dehydrated and really bad edema. So I told her she can't even use Beamer until she shows me that she's really hydrating, because, if your blood's sticky, it's not going to move well. So we have to, get the blood flowing to help it, further. Contraindications. The other thing is like cancer, if you're going through chemotherapy, we ask people to talk to their doctor and recognize that there's a lot of different things happening in your body. So we don't want you to confuse, what, that's the salt you might blame for symptoms or something, that it's doing the opposite effect because you're on all these other things. So again, it's just talk to your doctor mostly. Pregnant women ask all the time. It's the perfect place for someone who doesn't want to take medication. I have clients who are very sensitive to medications or even allergic and can't, tolerate drugs. Children who don't respond to, allergy shots. So that's another, but that's the only really contraindication. Even salt, where they, blame salt for high blood pressure, which I get it, it can, but breathing salt is processing through your body very differently, because we know when we drink or eat something, it's going through this very long gut that's absorbing everything. When you breathe salt, think about how many times you breathe in and out. So you're breathing out as much as you're breathing in. So you're processing that salt a lot faster. And also, it's a small amount of salt that we blow into the room that infuses the whole room. So you're not getting, even a tablespoon of salt. You're getting, actually, they say it's like eating or licking a potato chip is about what you're ingesting. And literally we'll tell people, if you really want to avoid the salt, don't lick your lips, because you will get, salt all over you. But what you're breathing in is infusing your lungs and your airways. And haven't even mentioned skin. We have multiple people with psoriasis and eczema, and activated salt, negative ion charged, lands on your skin and it activates your skin cells. So we see people really benefit with psoriasis and eczema and everything else, aging skin, acne. Plus Beamer has, some answers for that. With the skin, it has a red light attachment. So we are also using some red light therapy with that.
What about rashes? Does it help with rashes if people have a rash on their skin?
That could go either way.
What about if they have
salt aggravate too? So you got to be cautious.
Yeah, we don't want to put salt in the wounds, right? So
and we have children come in who will have, like, they scratched a mosquito bite, or they, have a cut. And so we put our magic goop on it and the Band-Aid if we can. And yes, we have had children. Magic goop is our Dead Sea ointment. So we have an ointment that we, carry a whole line of Dead Sea products. And it's even given out in some hospitals postpartum. And, it can be used for everything from cradle cap, on a baby, to hematomas, like those, when people, especially elder people, bruise easily. So again, really anti-inflammatory and a healing to the skin. So, and there are some things that, people have come in and said, their lungs are raw, like say post-COVID we see, right, with pneumonia.
Yeah.
So, you might go in there and breathe a little bit and say, 10 or 15 minutes was enough that first time. And then, just step out of the room and, come back in a couple of days and try it again and keep, building up a little bit.
Tolerance.
Yeah, but most people, 99% of people walk out and go, oh my God, it was bad. It's a relaxation they didn't know they could find. Not only are you in a dark, chill room, maybe reading, maybe listening to some relaxation music, meditating. I have a couple clients who say, I just pray when I'm in here. I use this time for, prayer, meditation, and just checking out like that. So healthy. But the benefit of breathing the salt plus the negative ions is just like the trifecta of relaxation for a lot of people. And the moms will say, oh, my kids slept through the night. Like they never do that. So nice side benefit.
And Jamie, what do you notice? How does salt therapy affect pain? So, you see patients with rheumatoid arthritis, and those patients are in a lot of pain. And do you notice an instant relief, or is it more gradual? How would you say?
I would say it's a little more gradual. The PEMF technology, I would say, is the one where people get on it and say, like, I can't feel my foot, I have neuropathy, or I have tingling, or this or that. And that they can step right off and feel some, instant relief for pain sometimes as well, which again, you guys can relate. With salt, I have a client who came in for bad sinuses, which sinus infections and sinusitis is, I don't know, maybe number one, because all these things can lead to sinus infections, right? COPD is another very popular reason people come. I've actually had people carrying an oxygen tank and start leaving it home after a week because they're nervous, so they're bringing it. I say like this because it's the smaller one. I've had people with the bigger tank. Once you get to that level, it's getting a little bit tougher to control. The rheumatoid arthritis. So this one client came for sinuses, and I was telling someone how the salt is helpful, in your whole body for inflammation. And she from the back of the salt room, she goes, "Is that why my knees don't hurt anymore? I've been wondering." She said, "I've been coming here, and I thought it was just the relaxation, but it's likely that breathing in salt is anti-inflammatory. And again, you can't stop it once it's in your blood, unless you have." I always say, damage, you had a surgery. We know that, what we eat, toxins, the EMFs, and all these things that are causing poor blood flow to one area or everywhere, that it's going to help with that. So, getting that salt, breathing it in is going to, get it to everywhere.
So patients with surgery who have had past surgeries, you find they're a little more difficult cases, or they don't heal as well, or they don't receive the benefits as well?
I would say, no, I would say everyone gets the benefits. I even, I've even had 2 clients didn't have back surgery because they both found the therapies were so helpful. And kind of interesting because I have a lovely new client and his wife, and they're retired doctor and nurse, and he's a brain surgeon. And he said, I can tell you that no one ever died from neck and back pain, but plenty died in surgery. So we really, it's a very, very big decision for someone to have surgery. So if they can, even if they're going to buy, PEMF technology and spend some thousands of dollars, they're likely going to find, some relief up until, even if they can delay the surgery, you just find other ways. But yeah, it's like I said, the salt and the combination. I've seen people, especially I have a neighbor actually who came for a long time, and she bought a mat for her home, and it's been I've been open 7 years, so it's probably been about 5 years ago, and she still has not had back surgery. And I was going to say also, the infusion of the blood flow is so good for, scar tissue. So anyone who's had surgery, think about how can, post-surgery, what can they do to avoid the after effects? Because we all know that any surgery, you're going to create scar tissue, in which people should be massaging and doing other things to help it break down and not become another problem later, right?
What kind of salt is it that's on the chairs and on the walls? Where do you get the salt from?
So we, this was all hand done, and this is actually the Lake Worth room, but mine looks almost identical. We hand through all the salt, Dead Sea salt, on the floors, and the walls are we hand through the walls. The floors are also Dead Sea salt. And then, but in the machines, it's pharmaceutical grade salt. So just think, pure NaCl that's actually could be made for medications that are injectable. So there are people who have pink rooms. They're pink, beautiful pink Himalayan salt rooms. It almost looks pink, but it's very white. And there's nothing wrong. We want you to eat Himalayan salt, Celtic salt, salts that are laden with minerals, not table salt, even though it's iodinized, or, right, the old table salt with iodine. We can find iodine in so many other things, but we encourage people to eat that salt because it's loaded with minerals. But by breathing in something like Dead Sea salt, you'd never put in our machine because there's too many impurities that could break the machine. And let's say, we were blowing Himalayan salt, and I have clients who come in 3 doubles a week. So they're there in my room 6 hours a week to control COPD, for example. They don't have to be all the time, but some choose to. If we were blowing Himalayan salt, there are some properties that are heavy metals, right? Minerals that possibly might not process out of your body. Salt, NaCl, does everything we need. It's the little particles, the crystals, essentially, that are, jagged when they're broken and acting as that scrubbing effect, anti-inflammatory, all the properties we need are in that salt that we put in the machine and blow into the room.
So somebody comes in, tell us, let's say I'm a new customer. I come in to see you. I saw the podcast. They say, wow, this sounds fascinating. I got inflammation all throughout my body, or I've had 2 knee replacements and I have inflammation. You said it helps with people that have had a total knee replacement and they're still having inflammation in the body?
Yes.
So let's say, okay, I want to give this. So they meet you. What's the process? What's the onboarding process for somebody? And, what are the options? I'm sure they can just do a one and done session. That'll have some temporary benefit. But then if they really want to receive the benefit, they're going to need to come in more frequently, right? This is not a one and done thing. So tell us about the different options that people have and recommendations that you make when people come in to see you.
Yeah, and that's what we do. We have people fill out a little intake form. Why are you here? What are you trying to treat? What do you usually do for it? And then we talk to them about their availability. So like you said, I've got a gentleman who comes in almost daily, about 5 days, and he'll pop right into the booth. He works close by, and he's gone weeks now without using his rescue inhaler. So he has asthma. So he brings his kids to the kids' room when he can. And now we've got school starting tomorrow. So we're going to see a huge influx of, oh, now my kid's getting everything, in the world with all the, right? So some people come in with, mild issues, just need to relax. And we have a once a week package. It's actually $89 a month, and they can just come 4 times a month, whether they come a lot, or once a week, but it's 4 times a month. But most people do a package, it's $109 a month, and for one person, and they can come as much as they want. And that would look like a lot of my clients do Monday, Wednesday, Friday. They'll sit for one session, and we're open from first session 9:30, last session on some days 6:30 p.m. So people come and sit for a few times a week. We're open 7 days too. Because of that, we've got, kids in school, people working, and people are, I'm too busy. So we have to talk to them about, so when can you commit to come? I don't want you to sign up for, and even spend $109 a month And, you just come once or twice a month, and you might have an experience like it was nice, but I still have to take my medication, and well, you're not coming enough. So someone with frequent sinus infections, bronchitis, COPD, asthma, and you're hitting your rescue inhaler multiple times a week, we're going to ask you to come in, especially at the beginning, a lot more. So come in 3-4 times a week, or people will come and sit for a double session. So sitting in here is like the best nap you've ever had. So people could come like 2 days a week and do a double. So they're in there for, almost an hour and a half, maybe closer to, it's 2 45-minute sessions with a 15 in between. So an hour and 45. And then they'll experience the benefits by, coming more regularly. And then, like I said, some people are just, once or twice a week is enough. And of course, we have people who just love to do it once in a while, or they'll come just for allergy season, which, here it seems like January through March is our worst allergy season, but we've got multiple seasons and people are allergic to different things. And we are talking about environmental allergies. I've had multiple people ask me about food allergies. We're not touting that this ever helps with that, which might seem, when I say allergies, people can jump to, oh, well, this or that. If you're allergic to your cat, this is going to help, because getting that salt into your body, the salt stays in your body system for a while. I've had people say a few days after they were there, they coughed and they felt like they coughed up salt. Well, salt gets into your system, lodges in the mucus. That just tells you that you had mucus in there for days that finally dislodged from the salt breaking up,
Speaking of pets, can you bring your pets in that room?
So we have, we had a couple years where a lady brought a beautiful macaw. He would cough and snore so bad at night, he has fallen off of his perch. So it was very, very helpful. And getting him in there in a, his big crate, his big cage was difficult. She would put him in the booth. We've had also multiple, we've had one cat come with her owner and a couple small dogs, and it has all the same benefits, including one had the super itchy. No matter what they did, the dog was just itchy all the time. And after one salt treatment, didn't itch for a couple days. So it really can relieve, again, the inflammation. Bless you.
Thank you.
So yeah, people can bring pets. It hasn't been overrun with pets, but the booth is a great place to do it. We've had people have them sit on their lap. And along with that, we have a local veterinarian here who uses PEMF on the animals in his clinic. And I also recommend that for people with animals with, so when you go to invest in a PEMF technology, you can use it on the whole family. I have a teenage daughter who's on her feet all the time. She comes home and wraps her feet with Beamer. My husband, he needs it for all kinds of stuff. He's in construction, so he's, always achy. And, but for the pets, this doctor uses it post-surgery and also pets with injuries that don't require surgery. And he's been using it for many years. If you want to know who he is sometime, it's actually Paws to Care up in Jupiter.
Can you tell us what's been, for somebody that's been coming regularly, what has been your most memorable success story of somebody using the salt therapy?
Gosh, mostly probably the COPD, because you're looking at someone who is gone from, one lady in particular, using this oxygen therapy at night. And she was a lifelong smoker, grew up on a tobacco farm. She said, we kids were smoking cigarettes at 8. It was everywhere. Just everyone smoked all the time. And she lost multiple siblings to lung cancer, et cetera, COPD. And she came in with an oxygen tank and said, now the doctor says, I was doing this at night. Now I have to do it. That's when she came to us. Now I have to do it, carry this thing all the time. So she is one of the people who started leaving her oxygen tank at home after maybe a week or two, and came for many years. And she actually went from, she was a real pistol. she said she went to her doctor after 3 months of coming to us. And he said, wow, your breathing's really great today. And she said, I think it's the salt therapy. It's really, I'm not using my oxygen the day like you told me to. Use it still a little bit at night. And he said, I just think you're having a good day. She said, okay. So she went back 3 months later. And he said, wow, your breathing's really great, this and that. You're still doing that salt therapy? Yes. And he said, she goes, you still think it's just a good day? And he took her from 4 daily medications to 1. And she was like that for years until COVID. So frankly, she didn't come back since COVID because she got so sick during COVID. She's completely housebound. Yeah.
Well, this has been a very enlightening show. Dr. Hudson, do you have any closing questions or comments before we wrap the show up?
No, it's incredible. It's absolutely incredible. Congratulations to you.
Yeah, a lot of our listeners, they're not familiar with salt therapy. So I'm going to be sending my patients over to you that I think they could really benefit. I mean, it's natural, it's safe, it's effective. And it sounds like you not only just put them in a room, but you have a wealth of information and knowledge that you can pass on to them to help them live a more natural and healthy and pain-free life. So this has been very enlightening and we appreciate your time. So Jamie, how can our audience get a hold of you? Can you give us your contact number? Can you give us like your website and phone number to reach you?
Yeah, so we're right on PGA Boulevard in between 95 and the Turnpike. So it's really convenient for people to get there. Like I said, we're open 7 days. The phone number is 561-316-3105. So, and like I said, we're, right here. We do have 3 other, I only own this location, but we have 3 others in the county: Boca, East Delray, and Western Lake Worth. And when you're joined, you can go to any facility. We have a couple in New Jersey, St. Pete, one just opening in Chicago, and one opened in North Carolina. So it's a slow go, with opening these franchise locations, because like you said, anyone can open a gym and you're going to take clients from one gym to another gym. But to ask people to do something brand new and put this into their, healthy lifestyle routine, it's a little more challenging.
Well, you're going to need to open up an office in Los Angeles there for Dr. Hudson's patients can go to. They don't have a place
absolutely.
to go to. Right?
And I'd love to talk to you guys. And honestly, before I opened this business, I went, can't we get this to a lot more people instead of me just opening one at a time? Can't we get this to a lot more people if I just go to doctors and say, let me build a salt room and that'll be your waiting room? And then doctors, health practitioners of any kind, especially chiropractors, who are into, treating the whole body. We could put salt booths, which if you ever want, there's not enough in California. I search for people every time they come in from somewhere else. They're like, I don't have anything like this at home. And I'm like getting on there and finding something for them because, my thing is, I am an entrepreneur, right? I'm a business owner, but something different lights up everybody, and it's not money for me. For me, it's this healing and helping our community, seeing that they can take control of their health and wellness. They don't have to leave it in the hands of other people. And, they have a lot of other choices.
Mm-hmm. Yeah. And I love this natural, like your sign says, 100% all natural alternative. And there it is. What have you got to lose?
And like you said, it's so relaxing. People, opening that business has been such a blessing. It's, the people I've met, and, we have a community here that now comes together there. We have really fun events. We have, whether it's sound bath healing which is another kind of healing sound, you guys do some kind of sound healing, right? Vibroacoustical. Okay. And by the way, I plan on coming to see you as well.
Yeah.
I've been traveling really far for a chiropractor.
Oh, well,
so
yeah. We'd love to have you come visit and,
I want to check out your space and your PEMF, what you're doing. And I'm always eager to learn.
I always joking around sometimes when I leave the house, I always tell the kids, okay, back to the old salt mine. Well, you say that, you really mean that.
Yes, and you should see, and you guys know how hard it is to staff.
Your staff must love working there. Can I get a job there?
Yeah, please. I always say when we've had such a hard time hiring, just in general, it's been, and I never did before. I had one employee for 6 years. really wonderful staff. But yeah, it's one of the side benefits. And I do hire, it seems like quite a few people. Well, so many people have asthma.
Yeah.
It's just like, seems like the most common thing in the world.
Hey, to all our listeners, if you know how to, answer the phones and book appointments, and if you're good at admin, go see Jamie here. She's got a great job for you. You're going to benefit in more ways than one by working there. Jamie, it's been a pleasure.
Yeah, it's been a pleasure talking to you guys. Thank you so much.
This has
Thank
been
you,
great.
Jamie.
I'm sure that patients are really going to love this show. And thanks again for enlightening us all. We appreciate
thank you both. Look forward to meeting you in person.
Thank you for listening to the Taylor Method for Pain-Free Living podcast. For more information about the Taylor Method and how you can find lasting pain relief, visit www.drderektaylor.com. That's www.drderektaylor.com.